Thank you, Mkamiti, for having me. Always a pleasure to come back.
Thanks. Explain to us the difference between menopause and andropause.
Now, menopause basically refers to the final menstrual period, which occurs around 51 years of age. The range is between 55 and 55 years of age. Clinically, we diagnose it when a lady who is more than 45 years of age has 12 consecutive months of no menses. Andropause, on the other hand, quite controversial to be honest, is the gradual decline in testosterone levels, which starts at around age 40. Now, for a small percentage of men, the decline in testosterone levels is significant enough to cause clinical symptoms. And then at that point in time, you'll say that somebody has andropause.
And what are the challenges associated with menopause and andropause?
The main cause of menopause will be the decline in estrogen levels. Basically, the ovaries cease to function. Estrogen has a lot of functions in the human body, from the brain to the heart to the muscles, everywhere. So more than 80% of ladies who have menopause will have the classical hot flashes. They will have issues with the sleep disturbance, mood changes. They are prone to develop cardiovascular disorders. They are prone to having a condition we call osteoporosis, which can predispose them to getting fractures. On the other side, andropause mainly due to the decline in testosterone level. What you'll see is more often than not, the symptoms will be sexual in nature, low libido. Some will lose hair. Some will also start losing muscle bulk, among other symptoms.
Dr. Gwako, is it possible for a woman to enter menopause and return to her menstrual period as usual?
A few ladies will start having what you'll consider to be normal menses after menopause. However, clinically, we don't consider that normal. We call it postmenopausal bleeding. It could be physiological, but it could also be one of the earliest signs of gynecological malignancies like ovarian cancer, endometrial cancer, and cervical cancer. So for anybody who has gone into menopause starting to have postmenopausal bleeding, we advise that they have to seek medical advice so that they're investigated as to the cause of that bleeding. So yes, it can occur, but it's not considered normal.
And what advice do you give people when they enter menopause and andropause?
It is a normal physiological process. So for menopause, what is known is that 100% of women will go through it if they live to reach that age. For andropause, it affects a small proportion of men. As of now, as I said, it's controversial. So what we advise for women who go into menopause, they don't have to suffer the symptoms of menopause. About 20% of women will actually have very severe symptoms, but fortunately, there is a cure. They can be put on hormonal replacement therapy that can reverse up to 80-90% of the symptoms. It can also prevent them from getting the cardiovascular complications. It can prevent them from getting osteoporosis and the fractures that we talked about. For men, also when they notice the decline in muscle bulk, libido, and all the other signs of andropause, we also encourage them to seek medical advice.